Hi, I'm Professor Anne Tiedemann from the Institute for Musculoskeletal Health and the School of Public Health at the University of Sydney. I'm also one of the co-founders of the Falls Prevention Alliance Australia. In this series of 3 presentations, I'm aiming to raise awareness about falls in older age and what we can all do to prevent falls. In this 3rd session, I'll be talking about strategies and resources to help you to put the evidence into practice. So I'll touch on starting conversations about falls, managing stigma and shame associated with falls, the complexity of changing behaviour, and some resources that can assist with intervention implementation. So let's get started. Before I begin, I'd like to acknowledge the traditional owners of the land on which I am today, the Wongal and Gadigal people of the Eora Nation, and I pay my respects to elders past and present. So first up, I'll just do a bit of a recap on what I covered in the other 2 presentations in this series. We talked about how falls are common in older age and they come at a high personal, societal and economic cost. I talked about the strong evidence that we have that many falls can be prevented. And I really focused on participation in regular ongoing exercise that challenges balance and strength, and that this should be promoted to all older adults. And then I also talked about other interventions to prevent falls that address specific risk factors, and these included things like maximising vision, addressing foot health, medication management, and other risk factors that are also important. So we've got all this evidence about how to prevent falls, and we know that falls are a huge issue and a big barrier to healthy ageing. But how do we open up a discussion with an older person about healthy ageing and fall prevention? Well, sometimes it can be helpful to tap into their individual motivations. We often talk about how important it is for older people to be spending time with their family and friends, to be enjoying their hobbies and interests. Most older people are very motivated by wanting to maximise their health and well-being so that they can live at home for as long as possible. We talk about the importance of keeping active, managing health conditions, and many older people are caring for their loved ones, be that their partner, their children, or their grandchildren. And so a lot of what we can focus on when we're talking about fall prevention and strategies to reduce our risk can be focused around staying independent and steady on their feet, as well as mentioning the importance of preventing falls. One of the barriers, though, is that it can be difficult to engage older people in a discussion around fall prevention. There's been some research done a few years back now in the UK that looked at the attitudes of older people towards fall prevention advice and how we need to navigate conversations to successfully engage with older people. The research conducted by Yardley and Todd found that there's a certain amount of stigma and guilt associated with falls, and that suggesting that falls are personally relevant to older people can actually be a threat to their identity. You can see some quotes on this slide that illustrate these points. The other theme that came out of this work was the lack of personal relevance to some older people. Many older people believe that fall prevention information or strategies are not relevant to themselves, but are relevant to other older people who they consider are older and at a greater risk of falling. So these themes demonstrate that we do need to tread carefully when we're talking about falls and fall prevention with older adults. And because of this stigma and guilt and the lack of personal relevance, sometimes we find that there's poor uptake and adherence to fall prevention interventions. So how can we navigate this? So to a certain degree, we need to get better at selling fall prevention. much of the research does demonstrate that risk reduction messages such as reducing your risk of falling may be ignored. And so sometimes it's more effective to focus our messaging around promoting positive identities that are relevant to older people. So as I touched on before, we can be talking about how to maintain independence, staying healthy, physically active, and doing the things that older people enjoy, and promoting activities that enhance fitness and balance. Because the word falls in some situations can have this overriding negative connotation, and so focusing on the healthy aging messages can be more effective. But regardless of how we sell the message, it's important to open the conversation early. We know that steps can be taken to prevent the first fall from occurring, so we shouldn't be waiting for a fall to occur before we start to take action, before we start to open conversations, and before we start to support older people to put in place interventions that can prevent falls. And part of the process of opening up these conversations is busting some myths about falls. And there are quite a few myths that or views held by older people that are not completely true. So one of the myths around falls is that falls only happen to frail older people, and we know that this is not true. We know that anybody can fall and sustain a serious injury, and we know also that balance and mobility starts to decline at around age 40 or 50. So actually we should be talking about fall prevention in the middle age period. There's also a myth that falls are part of the aging process and can't be prevented. And I hope that I've shown to you during the other presentations that this is not true. We have a lot of evidence that falls can be prevented, and that it's never too late to start taking action to prevent falls. The other myth is that falls are common, but the injuries are not serious, and this is certainly not the truth. We know that in Australia, around 17 people die each day as a direct result of falls. 400 people are admitted to hospital each day due to falls, so falls can be very serious. Another myth is that only older people need to start thinking about preventing falls, and as I said before, really we should be starting these conversations in the middle-aged years. And that finally there's a myth around the only way to avoid falls is to make your home safe. The home environment safety is certainly part of the solution, but it's not the whole solution, and we know that falls occur due to an interaction between a person's physiology, their environment, and their behaviours. So we need to do more than just making the home safe to prevent falls. So we do need to tap into individual behaviour change to take effect and to have see a reduction in the risk of falling. What does this mean though? At the individual level, fall prevention is all about helping people to change their behaviour and take action to reduce their risk. And the COM-B framework can help us to think about the factors that influence our behaviour. We know that people don't just need information about what to do to reduce their risk. They also need to feel like they have the capacity to do what's required, or the capability as demonstrated in this framework that we can see here. They also need a reason to make the change, or a motivation. And so we can be having conversations around people's motivations and how what their life could be like if they took charge, if they took actions and they reduced their risk of falling. And finally, they need to have the resources and the opportunities required to make the changes and to take action on falls. So it's important to realise that simply telling older people what they need to do is rarely enough to actually change behaviour. So some of the behaviour change techniques that can be included in interventions such as exercise programs for preventing falls are shown here on the screen. And some of those things can be things like setting goals, using an action planning approach, helping people to self-monitor how they're going with taking part in the activities that are recommended, and also engaging social support to promote that motivation and adherence to, say, exercise programs to prevent falls. What I'd like to do now in the second part of this presentation is just to talk about some resources that may help you to implement fall prevention exercise evidence. So the first resource is the Safe Exercise at Home website. This is a freely accessible website that was designed by physiotherapy experts in Australia, and it contains videos of exercise programs that are suitable for older people at different levels of function. And there's also information there for older people around how to undertake exercise that's safe and effective and certainly has relevance to fall prevention. The next resource is the Active and Healthy website. This is a database of physical activity opportunities in New South Wales that are relevant for people aged 50 and over. It's also freely accessible and funded by New South Wales Health. It's searchable by postcode, and it's a great resource that has additional information about staying healthy and avoiding falls, and the information about exercise programs is kept up to date. It's also possible to select fall prevention as the focus of the exercise programs, and you can receive a list of those relevant exercise programs for falls. The next one is the Physiotherapy Exercises website. Again, it's a freely accessible resource, and it can help health professionals to promote certain exercises to their patients. Again, you can tick a box to select the exercises that are relevant for fall prevention, and the printouts or the information that's provided includes clear pictures of the exercises as well as a description of how to do the exercise, and then ways to increase the intensity of exercise for each of the specific exercises. So this is an evidence-based resource that can be very helpful in delivering information to your patients or clients about fall prevention exercise. Then finally, just to give some examples of effective fall prevention programs that are available publicly. Many of you will have heard of the Otago exercise program. This is a home-based strength and balance program that's been around for many years. The Ironbark program was a tailor-made program that's suitable for Aboriginal and Torres Strait Islander people. It involves yarning. It's a group-based program that involves yarning about healthy aging topics and also a specific exercise program that's targeting strength and balance. The LIFE program is about integrating functional exercise into everyday activities. Again, it's validated and shown to be effective in preventing falls. Similarly, the Stepping On program, an 8-week group-based discussion and exercise program with relevant topics around fall risk factors, and includes a tailor-made exercise program for fall prevention. And then finally, the Foothold program, which is specific to foot and ankle exercises and targeting fall prevention. And then 2 programs that are remotely delivered or delivered online. First up is the Top-Up exercise, which was developed more recently. It's shown to be effective in preventing falls and improving mobility in people who are living in aged care or receiving aged care in the home. And then the Standing Tall program, which is more targeted towards more active community dwellers. Again, it's an online program and focusing on tailored and incremental exercise for fall prevention. If you wanted to find out more about falls in New South Wales or fall prevention in New South Wales, there's the New South Wales Fall Prevention and Healthy Ageing Network. There's a forum each year that's a one-day conference held in May that's excellent in terms of finding out about the latest research and also networking with other people who are interested in this field. And you can look at several conversation pieces which my colleagues and I have written, which is our attempt to synthesize evidence and deliver it in an accessible way to members of the public as well as health professionals. So just to summarize then, what we've been talking about is that falls are common in older age, but they're not inevitable. And we really do need to be getting that message out there to the public that we can take action on falls. We need to be promoting evidence-based exercise and other interventions that are targeted to particular risk factors. It's important for education and training to be delivered to all staff who have contact with older people so that we can spread this message widely. We should be considering the preferences of older people when delivering fall prevention programs, because if we consider preferences, we're more likely to have success in terms of uptake and adherence to those interventions that we know will work. We know that falls prevention is everyone's business, so we should be engaging the older person and their family and support networks in these discussions. We need to work as a team with other health professionals, and this would include physiotherapists, exercise physiologists, podiatrists, occupational therapists, optometrists, and pharmacists. So it takes a big team to manage someone at high risk of falls well, and we need to be prioritising this. Please remember, we should be starting the conversation early. Don't wait for the first fall before we talk about taking action on falls. So, thank you for listening to this presentation and the other two in this series. I hope that you've learnt some strategies to assist you to talk about fall prevention with the older people in your life. If you want to help to spread awareness about prevention of falls, you're very welcome to join the Fall Prevention Alliance Australia. You can see the website here. We are working hard to try to spread awareness, agitate for policy action, and investment in fall prevention services that work. If you want to learn more about how to prevent falls, there are online educational workshops which you can access at the link shown on the screen below. Thank you, and I look forward to hearing from you if you have any questions or comments.